I'm Dr. Vikki Peterson from Root Cause Medical Clinic. This is Valeriya, our nurse practitioner.
Hi.
And we wanted to chat today specifically about one of Valeriya's areas of expertise, which is fertility. And
Yes.
It's very exciting because, of course, here at Root Cause, we do natural means. And why don't you explain a little bit, if you want to start with maybe your background a little bit and how you got into this, and then we'll go into the program that you're finding so successful.
Absolutely. So I am Valeriya. I'm a women's health nurse practitioner. I'm board certified in OBGYN through conventional medicine. I worked in conventional medicine for a number of years. So I've been all over community health, Stanford on the East Coast. And I found my way into natural fertility first through birth control and really understanding the effects that birth control had on many different women, particularly women who first were put on birth control and suffered, and then got off birth control to get pregnant and suffered.
So we're talking about and I shouldn't say the standard birth control pill because there's so many of them.
Yes, hormonal birth control.
Right, and these are synthetically based, and then we have something like Nexplanon, which is
IUDs
in the arm. Okay,
NuvaRings, pills, progesterone-only pills.
Yeah.
So you really enter this world where women don't know anything that's going on with their bodies. We really do give. We outsource our control. We outsource kind of what we're supposed to know about our body, and then we get to a certain age where we almost want to turn the light switch on, and we're ready. And suddenly you look at the cute little baby, or you got the promotion, or you bought the house, and you're ready to go.
Right.
And you realize that your body is not necessarily going to just go.
Right. And there's, I think, I wouldn't say nothing worse, but very high up on the scale of terrible and devastating for a woman is being ready to get pregnant and you cannot.
Yes, and that's, I think, also what I make very clear to women is that my goal with fertility is not for women to get pregnant. It is for women to have such control over their bodies and be so fertile that they get to choose what they want to do. You get pregnant if you want to get pregnant, or you just have healthy cycles that are not painful.
Right.
And you know how to not get pregnant.
Right.
You really have control over your fertility, and that's what it comes down to.
Exactly. And do we want to touch upon the problems with the synthetic hormones? Because I know you have and I have run across so many young women, and they've got acne. A lot of times they're put on the birth control pill for not even because they're sexually active and want to avoid a pregnancy. They're put on it for another reason, or they're young, they're a teen, they're in college, and it seems like this easy thing, and nobody paints the picture of the potential problem later on.
Yeah, and I think you're absolutely right on, because I was a birth control specialist, and so I was prescribing, and I was inserting, and I was doing everything, and you do it from such goodwill. I was on it myself for over a decade.
Wow.
And so you have this firsthand experience of knowing that I went on it for all the right reasons.
Right.
And you never think, and I'm very clear with women now too, that the birth control isn't the only reason. It's just that no one even bothered to investigate why. And that's really where the problem is. Why were you put on it? Why were your cramps so painful? Why do you have PCOS?
Right.
Why do you have acne? Why do you have migraines?
Exactly.
Let's just do something with a pill. The pill winds up completely dysregulating a natural cycle because we've been really taught to demonize it. Right? It's this crazy wave that you're not supposed to catch.
It's like, I cannot have it for a while? Great. If I'm ready, I'll let you know,
exactly.
body.
Exactly. And so you wind up like, welcome to the club. Everything sucks. You get to be totally crazy, or you're going to cry, and then you're going to be in so much pain, and it's really not selling it quite well.
Yeah.
And so it really is a wonderful club. That's what I'm trying to tell women, is that when your body's in favor of you, when you realize that it's not trying to kill you, it's trying to save you, that your period is your monthly report card. You'll hear me saying a lot of these things that are
it's so true.
It is, because then you get to look into it and say, but why did we get here? Or how did we get here?
Right.
And how do we very graciously undo it? How do we actually just not keep listening, but listen for the first time to you?
Right. And that's so true. If women realized, men are different, but for we women, we have a monthly reminder, is everything okay? Is everything working the way it should? And we've also met the women that have become amenorrheic, so they have no periods for a variety of reasons, and that will get a woman's attention if she's not on birth control. So there's some part of us that knows that should be there.
Exactly.
But we also fall into the trap of the PR of it all, like, you can
ride a horse. You can ride a horse. You can go surfing. You can do all the things
and you'll never
that you
have
can't do.
Right.
The problem is you just have to give up your brain's literal response to try to keep you healthy.
Right.
And so therein lies the paradox, is that whatever you choose, you lose.
Yeah.
And that's not what I'm about. And
Sure.
the women who work with me know I get very feisty about this.
Yes.
Because we should at least be in a world where it's neutral, but it shouldn't be lose-lose.
Yes.
And so it really is about winning these things back long term. And so for a lot of fertility work, it is undoing things without guilt, without being like, how could you? Because I did too. We were all on birth control because that's just what you do.
Right.
The most important thing is that you make a choice to say, but how do I actually listen to my body and realize that it's not after me? It's not after me, and nothing's ever going to go terribly wrong without us figuring out but why. Right. And so fertility is almost the pinnacle of that, because you have a goal, and it's not, do I feel better or not? It's, am I or am I not pregnant? It really is that black and white. And so whereas a lot of, functional medicine is extraordinary in general, but pregnancy is its own category. It's not, yes, I feel better or I see improvement. It's, am I pregnant, yes or no?
Right, when that's the goal at the moment.
Exactly. And when that's the end goal, you really are kind of at the tip of the iceberg and really diving way, way down.
And so what would you say in not a nutshell, as in, I'm not asking you to do it in 2 sentences, but what are you finding your successful actions to be? And do you want to start with a woman who's been on the birth control pill, has done some sort of it? Because that's probably the majority.
That is a majority of women, absolutely.
So let's look at that type of woman, and she's trying to get pregnant and she's not being successful.
Yeah, so I think the thing that still surprises me is that there's a lot of success. There's a lot of success where women almost find me to prove how unsuccessful it's been. That's what a lot of our patients have said who have gotten pregnant is, I still didn't believe I'd be the lucky one. You you have this narrative that, well, of course that's just how it is for me. That's how the cards fall.
Right.
It's been a year, it's been 5 years, or I've been miscarrying, or there's been amenorrhea, or there's been all these things. And so first, for a woman to actually understand that someone listens to you changes everything. In the world of fertility, you're broken. Now you're even more broken than you think you were, because not only did you have painful periods, but now you can't do the thing that you want to do.
Right.
You're left feeling, well, what are my options? Clomid or IVF? Or do I get puffy? Do I get depressed? Do I spend all my money?
So you're talking about how expensive IVF is, and that these synthetic hormones just make you feel terrible.
Exactly. And you can get an end result. Right. For a lot of women, if that's the route that they choose, I don't see anything wrong with it, other than the fact that they're not given other routes.
Right.
And so really to come into this, for a woman to really understand that fertility starts decades back, right? It's, were you on birth control, or did you have gut issues? Or what are these big red flags that people said didn't matter, which leaves you to feel that the problem is you.
Sure.
Nothing could have happened in your life that led up to this. It just sucks for you.
Right.
And so to really back up and understand this timeline is really where it starts, because oftentimes you find hidden sources of nutrient imbalances. That comes up all the time with women who have been on birth control.
So that's one. You find nutrient imbalances.
Nutrient imbalances are huge. The birth control pill is shown, part of the mechanism of action is it depletes certain nutrients. Things like zinc, things like selenium, things like your vitamin Bs. These are critical not only to function, to overall physiological function, but to things like thyroid. Well, you start questioning why so many women on birth control have thyroid issues. Well, now you have a thyroid issue, and if you have a thyroid issue, it becomes a lot harder to get pregnant.
Sure.
But now you're off the pill.
Yeah, they don't
thyroid.
appreciate that the thyroid up here has a lot to do with ovaries and uterus down below.
Right, exactly. Right. And so it's this connection of finally understanding how all of these organs are connected. You have receptors from you have different receptors on different organs. They're talking all the time, making this exchange.
Yeah.
And so to really understand, what is your nutrient status? You'll hear me say this all the time. It's not what you eat, it's what you absorb.
Exactly.
You can have the fanciest diet, you can have your personal chef, you can do everything. You're not absorbing the food.
Right.
That's it. And so
you might have a terrible diet also.
Precisely. Exactly. You might literally just, or you might even think you have a great diet.
Right.
And it's just not serving you.
Yeah.
So it really is first establishing what goes in. No toxic things anywhere. This way, anywhere.
Yeah.
It goes for, same thing goes for tampons, for pads, for these things that we've learned to use.
Right.
Toxicity plays a big role. Yeah. That's number 2.
So you think with 100% cotton and
you think with 100%
chemicals.
Cotton, I always joke, or you realize that if you set a tampon on fire, which I do not recommend people do, but if they choose to,
that one. Yeah.
It will, if you want to really make a point, the tampon tends to burn with deeply black smoke.
Wow.
Which is very interesting.
Now this is not the cotton ones.
Not the cotton,
okay.
but just the basic,
the Kotex.
Are you okay
with cotton tampons?
Yes, and I also want women to know that your tampon can actually, or whatever you're using, if it's not organic, it's being absorbed through tissue that's very absorbent. No. That in itself can actually create more cramps.
Yeah, wow, that's an amazing
point.
Yeah.
You can actually, I've had women just switch out what they use, and they already find relief in their periods.
Wow. Something a woman would never.
Yes.
It's like you go to the drugstore,
you pick up whatever is on sale, or the fancy one that has the cute little design.
Right. Okay, so the nice boring cotton ones from Whole Foods or the like,
Yes.
Okay.
Exactly. Or things like cups, like discs, like for you bleeding underwear. There's so many options now for women where every single step is you getting control back. What do I put in my body? What do I put on my body?
Right.
So that's a big one. Toxicity plays a role. I find oftentimes women have toxicity, mold, chemicals, mercury.
Right.
We actually test for these things.
They loved tuna,
sushi,
sushi,
all day,
one.
Every day.
I know. Don't you just want to?
Yes.
Yeah.
So
there's those fish laden with mercury that are just abound on sushi counters. Yes. Okay. So that's a big one, and then we look for mold. We've got a great test for that, which is nice.
Yes. It is. I mean, fertility is the ultimate test, don't guess. Which functional medicine? I mean, that's the cornerstone of functional medicine.
Right.
Test, don't guess, and do all of the other good things,
but
provide data. Providing data in the world of fertility is unlike any other world, because you get to point to something and say, let's work on this. You're not broken. There's these parts that need healing, and it's very systematic. So you're looking at toxicity, you're looking at nutrients, you are repleting nutrients.
Now when it comes to nutrients, we talked about you can be putting the best nutrition in, but if you're not absorbing it, obviously that's a big key. And then what about food sensitivities? Do you find those to be frequently
so that's number 3, which I guess should be number 1,
or
should be like point of entry is the gut.
Yes.
So things like food sensitivities, my question that women will hear me ask a lot is, okay, but why? What do we do with this information? Food sensitivities are incredibly important to me to understand, but how did you get here? And so for fertility, it always starts in the gut, because that is where you absorb. I want you to get the goods. And so if you have gut infections that are preventing proper immune response.
So we do stool testing. We look for everything from parasites to amoeba to
yeast is a big one. If you're super, super inflamed, or if your probiotics are low. Everyone now is on
the good bacteria.
Yes. So the good bacteria, and everyone's super excited about good bacteria. So they're drinking their probiotics or they're eating their probiotics, but the fact of the matter is that they're the wrong ones.
Yes.
And so it's very liberating to look at a test and be like, that was not ideal for you.
That was not for you, right.
Surprise, we have to go this route. And all I hear from women all the time is, I didn't even hear about that one before. Acar what?
Yeah.
Or
my favorite, acromantia.
Yes, it's my favorite too. Exactly. So there's these ones that you get to look into, and to me, the gateway into fertility is stool testing. It's then which leads to gut healing, which leads to understanding your nutrients, your
show
food sensitivities.
Leaky gut and so what food sensitivities do you commonly find?
Gluten.
Isn't it amazing how it's a player in so many things?
It's a 2 for 1. It's a 5 for 1. I think what I mean by that is where there's gluten, you have to think of where it comes from, what it's sprayed with. Gluten is sprayed with glyphosate.
Right.
Glyphosate, if glyphosate is commonly known as Roundup.
Sure.
It's the pesticide that makes things grow, and it's the pesticide that makes women's hormones wacky.
Right. So all these hormone disruptors in our environment. Now, if somebody, what's nice is we have a very easy test for gluten, which will go all the way from span celiac to gluten sensitivity.
And leaky gut.
And leaky gut. It's such a great
test.
I love the test.
Certain toxins.
Yeah.
Exactly.
And
it's
then
incredible.
It's just a finger prick.
Yep.
Well, a few finger pricks to get enough.
Yep.
But you know, if you're scared of the needle, it's not the in the arm kind of thing. We can do it fairly easily.
Exactly. And I think going off of that, a lot of the tests that we do are not incredibly invasive. And so you're not feeling like you're constantly getting pricked. You're not constantly prodded.
Right.
Sometimes you're just peeing in a cup.
Yes.
It's very liberating when your other alternatives where here's 34 shots into the thigh, into the belly, if you're going
so
like the route of IVF.
The IVF. Such a miserable experience.
So, and it's and I've worked with a lot of women who have done that, and if it works, it works. That's wonderful.
Right. You get that baby at the other end, and you're happy.
You do, but even the recovery time is different.
Right.
Because you went into it not optimized.
Right.
And so you see a lot of postpartum anxiety.
I was about to say the postpartum anxiety and depression
Yes.
because progesterone is the mellow feel good balancing hormone that they're being given the synthetic aspect of it, and so it can be tough. And then there's we say almost nothing worse than wanting to get pregnant, and then you finally get pregnant and you have this beautiful child. And you're not feeling, that love that you knew you would feel, and now you're really wondering what's wrong with you. And so, it's an evil little road, isn't it?
It's hard. It's hard because I think that what it comes down to is that every woman just deserves to be optimized and then make her own choice.
Right.
And nowhere in this do women even get a remote sense of autonomy, of saying that this is what I'm choosing given the information that I'm presented.
Right.
So you're presenting this information of here's your toxicity. Here's how we clean up your makeup. Here's how we clean up your house.
Makeup as in makeup.
Yes, literally, not exactly.
Right.
But you're really getting into toxicity, understanding that it's not just the sushi. It really is your everyday choices that you've already probably been making from an informed standpoint.
So we're looking at diet. We're looking at the quality of the diet. We're looking at nutrient levels, which could be, you could have had a good diet, but you're just not absorbing certain things from a variety of reasons. We're looking at gut health. It's very key. We're looking at food sensitivities. We're looking at toxins. We're looking at lifestyle, or what's called, exogenous, meaning from the outside in. You're not eating it, but the makeup's on your skin and the tampon, things like that. So we're cleaning up the environment as much as is humanly possible, which is decreasing the body burden. Is that it in summation thus far? Okay. I'm following.
Yes. So your cleaning products matter. Your hairspray matters.
Right.
Your mascara matters. These things, and the goal is not to overwhelm women and say you got to change everything out.
Sure.
It's to really have them understand how these things build up over time.
Can affect,
and they create this toxic burden.
Yeah.
And so you mix that with also lifestyle choices, like you mentioned, not just exogenous, but really understanding, are you stressed? For which women say no, and I say, please relax your shoulders.
Right.
Or stop. Like, we need to actually examine, do you actually feel like you're in a place in your life where your body wants to do this? Are you optimizing reproduction because your body's looking around and saying, this is a great time?
Right.
Or is it something that you really want and your body is saying, we have gut infections, we have toxicity.
Right.
What are you cleaning your counter with? Because my skin really doesn't like it, which is why I have skin rashes.
Right.
And everything is working against you, even though it really does want to work.
Yeah. I mean, it's a natural ability we women have, and also the body is so intelligent where it says body burden too high that I don't feel comfortable,
Exactly.
reproducing at this moment.
Exactly.
And then what about sleep? We haven't talked about that.
Do it. All the time. It is
not all the time.
It's not all the time.
But good quality is important. Yeah.
So sleep.
So we look at that.
I want to say they're not even. I don't even want to put them in order anymore because so many of them circulate in the same number one. Sleep is when we heal.
Mm-hmm. Yeah, and repair.
That's it.
Yeah.
It's when we're repairing. It's when we're healing. It's when our hormones do what they want to do.
Mm-hmm.
And so really understanding how to sleep. I have women who are getting 7 hours, 9 hours, 10 hours, and they wake up so tired.
Right. So quality.
So fatigue, really understanding how to get quality sleep, what to change.
Mm-hmm.
There's certain things that are very obvious and people still don't do.
Right.
There's certain things that are not so obvious.
Yeah.
And people don't do.
Mm-hmm.
And so really diving into every person's individual sleep habits and figuring out how they can do it. Because I think that's what it comes down to is a lot of what happens in fertility is women think, well, I'm just unlucky.
Right.
I just have diarrhea, or I just can't do this, or my periods are that's just how it is.
Yeah.
It's very startling for women when you start undoing things and they just start to feel good.
Right.
And it really just does create this positive feedback loop.
Sure.
And then the body just winds up doing what it wants to do.
Yeah. And so at Root Cause, we're all about looking at the body as a
Yep.
whole and appreciating the fact that you can't isolate any body part because they're all interrelated, which
Exactly.
I think you've expressed very well.
Yes.
And, when a woman is single-mindedly wanting to get pregnant, it's so what that I'm super stressed, or so what that I wake up exhausted, where's the baby?
Exactly.
And they don't appreciate the whole integration of all of this and the gut symptoms.
Yep.
And what about exercise? Is that part of the... Is that another number one?
There's this
man that wrote this book, and that's why I thought it was funny when you said maybe there's a lot of number ones, because he couldn't decide the priority.
I cannot, exactly.
So every chapter is one.
That's
right. So it was like chapter 1, and then it was chapter 1, and and people were like, And he said, because they're all important. That's what I was trying to express. So
this is happening.
There you go.
Yes.
Okay.
So exercise is actually really, really fascinating because either you need it or you need to stop it.
If you're doing too much.
So many women are actually doing too much, and that's part of the testing that we do. Everyone here knows, or the women that I've worked with know, I love the Dutch test. Mm-hmm. It is a hormone metabolism test where I oftentimes say infertility, sometimes how much hormone doesn't matter as much as where it's going. Mm. I want to make sure that you have enough, but it has to go down the right drain. Mm. Our hormones have to drain appropriately. They have to get eliminated.
Get excreted.
Exactly.
Yes,
they
because
have to
when
get
they
eliminated.
recirculate, I used to say they turn into the evil twin sister hormone.
Yes.
I'm sure you have your own expression.
Exactly. So they absolutely need to get out of our body. Mm-hmm. We need to excrete them in one way or another. Yeah. And so you need to make sure that it's also draining to get excreted appropriately.
And that's where gut health, not being constipated, liver
Yes.
being able to detoxify, etc.
Exactly. Mm-hmm. And so that testing really is amazing because it oftentimes shows, hey, you're not getting rid of your hormones appropriately.
It'll show that you're recirculating and then more of a toxic version, or
yes.
how would you?
You can actually see a lot of women who have breast tenderness or headaches, or you can actually say, hey, your estrogen, that hormone that really has a lot to do with this, is actually going down a pathway that causes that. Mm. And then we can move it over.
Right.
There's things that you can do. Diet,
mm-hmm.
lifestyle, herbs.
Yeah.
You really are getting into the nitty gritty. Mm-hmm. But that same test is the one where I look at women and say, we need to take a break from exercise. Okay. Which is the opposite of what a lot of women think. For certain women, exercise is incredibly important, but it's really important to tailor it to what your body wants. Yeah. And some women just think that more is always better. Right. And so they wind up doing double days. Right. And I'm having a lot of conversations of saying, please stop using your Peloton for just 1 minute. Right. Just 1 minute. Yeah. And we'll see what your body wants to do, because you can see the data. Mm-hmm. You can see when the body is so exhausted that now you're running on fumes.
Right. I
And
used to use the analogy, exercise is fabulous unless it's so much of a stressor that, you might feel good at the time, but if several hours later and or the next day you feel like a truck ran over you, that's your body's way of telling you what you're doing is too much.
Exactly.
Okay.
And so, but we're in a go world, and women think, well, if I lose more weight or if I sweat more, it's got to be good.
Yeah.
And the answer is it's not.
Not always.
It's not, and not always. And you need to actually be able to not have an opinion on that. You need to just be able to know how to look for it and get that answer and say, for you, for right now, this is what your body wants.
Right. And then for other women, you're encouraging moving a bit.
Exactly.
Because it's how
Exactly. So exercise is critical. It's just critical. It's so personalized.
Right.
That you actually get to leave it understanding what your exercise plan is.
Exactly.
Because it's a little more nuanced than just
part of what we do here.
Exactly.
And then also because we have the physical medicine side of things in the clinic, chiropractic and physical therapy, if a woman does have chronic pain from anything, that can act as a real drain as well, right?
On so many different things. First off, to get pregnant, you should probably have sex. You should probably want to have sex.
Right. So we need a libido.
So you need a libido. You also want to not be in pain.
Right.
There are women who are in chronic pain and just physically moving is difficult.
Right. Yes.
And so you want to be able to actually do the thing that achieves what you want.
Right.
And so there's women who are in chronic pain, which causes inflammation.
Sure.
And that creates its own stress on the body, which affects fertility.
Yeah.
There are women in chronic pain or who have pain where they're literally prevented from doing the thing that gets you pregnant.
Sure.
Or the chronic pain that puts you in the mood to do that.
Of course.
There are just so many different factors that we have a lot of women who are going to physical medicine.
Yes.
Or they have headaches that take them out of that mood and they get adjusted.
Right.
And really coming back and saying, your body is really working for you. These are just all the years that we haven't known how to listen for the signals.
Sure. Makes sense. Wow. Do you wanna brag about some babies?
We have a lot of babies.
Right.
Yeah, we do. We have a lot of babies.
Well, we have 3. I have 3. You have 1. But then we're talking about patients.
Yes. So
just kidding.
I am my own patient.
Yes.
I've done all of this before personally. We've seen a lot of pregnancies this past year. So we have pregnancies from women who have been trying for 5 years.
Wow.
Women who have had recurrent miscarriages, women who have told that because of prior uterine surgeries or just prior pelvic issues, the scar tissue would not allow for this.
Right. Okay.
Or that their genetics have shown them that they cannot get pregnant or continue on.
And you have foiled that at every turn. Huh?
Baby girls and baby boys have been born. I think it's about a 95% success rate at this point.
No guarantees, but
there's never. I joke. I'm like,
that is a lovely success rate.
It is because when you feel comfortable with your provider, when you know that they're here for you, when you know you establish this connection where you're both rooting for you,
right?
As you're literally rooting, you're literally like trying to figure out what's going on, and that you honor that this takes time.
Yes.
And when you really understand that, something just clicks. So there's a lot of women that come in here who I was just recently talking to that say, but you really don't think you're going to be the one.
Right.
It's a coping mechanism.
Yeah.
Of course.
Well, you're afraid to hope after how long it's been.
Of course. And so it really is about understanding that it's no longer the quick fix. And it really is that no matter what, you become the healthiest you've been.
Right.
That's it.
Which feels great.
That's it.
In and of itself, yeah.
Even if you go the route of IVF, you're the healthiest you've ever been.
And
the success rate is higher.
Yeah, we have to we need a study on that one. But and then not that I'm holding you to an exact time frame, but what do you see on average, like number of months ish?
I've had, so the life cycle of an egg is 100 days roughly, which means whatever you do now will affect you in 3 months. I tell women on average it's 6 months.
Okay, on average.
I've had certain women who laugh because there's at least a couple women I'm thinking of now where to the day it was 6 months.
Okay.
6 months to a year.
Yeah.
Is realistic.
Yeah, that's great.
It really gives the body time to undo and to heal and then to start thriving.
Because if you think about it, our programs are typically 4, 6 to 8 months. That's just to reestablish balance and regain function. And then you get the gift of, okay, now you're nice and balanced.
Exactly.
Let's get fertile. So Yeah,
exactly.
the 1 year makes a lot of sense.
Yeah, but what I find is I'm as pleasantly surprised as everyone else.
Sure.
When most of the time, almost all the time,
Yeah.
it's before the year mark.
Yeah, that's beautiful.
So
Okay.
a lot of very happy mamas, a lot of very happy babies. And most importantly, it's mamas that didn't think that was in the cards.
Right.
That's when it's something special.
Yeah.
Is that you just change a narrative.
Mm-hmm.
You just completely change a narrative.
Yeah.
So it's an amazing job. So
Right?
absolutely, I think every woman
We
who
love
thinks,
what we do.
oh yeah, we really do. We really do. Just because every woman that thinks she might not be so lucky,
Right.
just needs to realize it has very little to do with luck.
Yeah.
You really just get your power back.
You're just restoring function to the body, and
That's it.
And as I tell women all the time, and I'm sure you do too, it's like we're designed for this. This is whether you do it or not, we're designed to
Exactly.
do it. Yeah.
Just get so healthy that you get to make the choice.
Exactly.
That's it.
Beautiful. Well, thank
Yeah,
you so
of
much for
course.
your time.
Of course. I can talk about fertility all day, every day.
Yeah, and I could talk with you.
So it's been a
right.
pleasure. Thanks.
Thanks. And then, if you know anyone who's having trouble with fertility and, has been trying, definitely contact us. You can contact us via the website, which is rootcausemedicalclinics.com, or give us a call, 408-733-0400. And I hope you enjoyed this interview.
Yeah, thank you so
much
much for having me.